Well, there is nothing like a good night's sleep after a long and tiring day. But ask a person who has obstructive sleep apnea, and they will tell you the real value of quality and uninterrupted good night's sleep. These people often snore, stop breathing throughout the night, and suffer from tiredness throughout the day. As more research has been done on this topic, the role of dentists in diagnosing and treating sleep apnea has come into light. Today, we have my colleague Dr. Arpan Nandra here, and she is going to educate us on this topic. Dr. Nandra is a general dentist and practices at Serenity Dental Care in Edison, New Jersey, and she uses a comprehensive and multidimensional approach in diagnosing and treating her patients. Thank you for being here, Dr. Nandra. First thing first, what is obstructive sleep apnea?
Thank you for having me, Dr. Aurora. I appreciate it. It's a very big topic. So obstructive sleep apnea is basically a clinical syndrome that's categorized as breathing disturbances of the upper airway due to an obstruction or a blockage. So in simple terms, it means that a person stops breathing for a period of time, and that is measured in seconds through their sleep cycle. So their sleep becomes interrupted, it's disturbed. They don't get a full night's sleep. And it's important really to understand that it's not just one time in the middle of the night.
My next question is, why is it so important to diagnose and treat sleep apnea?
Yes, it is extremely important to diagnose and treat because it affects multiple systems of the body. So for example, it affects the cardiovascular system. And it does this because it increases the possibility of a high blood pressure or hypertension. In very severe cases and chronic cases, it can also increase the probability of somebody having congestive heart failure as well as a stroke. So as you can see, that's extremely important. It does affect the brain. How? It affects memory. You have a lot of attention deficit, daytime drowsiness. And in a lot of cases, a lot of research has it that a lot of the motor vehicle accidents are due to a daytime drowsiness. And a good percentage of those are because of sleep apnea.
My next question is, as dentists, how can we help in diagnosing and treating it?
Great question. We are the front runners, which is great. We're assuming a bigger role. So patients will come in, we screen them, we'll do then a comprehensive exam. After that, we do have to send them to a medical specialist, someone that is a sleep medical doctor. From there, they'll do a sleep study. And if they're in the mild to moderate zone, we then can get a prescription for an oral appliance, which they can wear. It opens up the airway. And we would go ahead and monitor them for a period of time, usually 6 months to a year, and then probably after a year, we would send them back for a sleep study to see if there's any other modifications to the appliance.
I hope you find this information valuable. If you have any questions about diagnosing sleep apnea or you feel you suffer from it, please consult with your medical provider, your primary physician, or your dentist, and they can guide you in the right direction about how to proceed in treating it. Bye for now.